customer out there for our services, absent government and grantor subsidy in hard times. And that was the motivation for our work with SCRA behind the value proposition, initiated under the watch of Mo Elias when he was SCRA president. How do we add distinctive value as a field, as a profession, as a field of interest? Do we differentiate ourselves from others in the field, like public health? That was part of what we developed in terms of the Practice Council, asking the question, how do we differentiate ourselves among these groups? What distinguishes us in that big stack of resumes? Is it our skills and competencies? Is it our context of community science that we practice our field? Or is it the values that bring us together? The next step in the value proposition is our work on the 2015 Global Community Psychology Employment Outlook Survey, being pilot tested right now. We'll ask current and future employers from a dozen workplace settings to rate how important our skills and competencies are to them now and in the future. That will help our training programs align the curriculum and our field to brand and position ourselves in the competition for work in an increasingly challenging marketplace to come. My work in health and human services is focused on program development and evaluation, and on community needs assessment and strategic planning. Now I'm helping my hospital system design and develop initiatives for a sustainable healing culture. Familiar to everybody, our series of core values and what defines us as a field really shape the boundary and the foundation for who we are and what we need to become. Four attributes define a healing culture for us: sharing responsibilities with our patients and their families, respecting diversity and cultural competence, embracing synergies among the physical, emotional, and spiritual connections, integrated medicine, and recognizing optimal well-being, prevention, and health promotion as integral to developing a sustainable healing culture. Margaret Mead said that all it takes for us is for a few concerted citizens to change the world. In fact, it has never happened any other way. In the basement of the Strand bookstore on 12th Street and Broadway in New York City is a remainder bin. And browsing that one day, I saw a familiar volume that caught my eye. It was a book that I had written, the first one I'd ever done, thrown into a bin with dozens of other books. And a somewhat closer look confirmed it. It was offered for resale at 99 cents. I was somewhat distressed that the project I had worked on for years was now worth only 99 cents. And then a second blow to my ego arrived. Even at 99 cents, I had no takers. And it's that exact figure, 99 cents, that centers the end of this talk. So we're going to come to here. And to here. This is a short look at the conceptual model that underpins the healing culture initiatives we're taking at Atlantic Health. Our goal is to build something that's sustainable and that will help us develop a program far after Joe Trunfield, our board chair, and all of us have left to go on to do other things. And it's centered on our vision, our mission, and our shared values. Charles Darwin famously said, he's neither the strongest nor the most intelligent among the species that survive, but those most adaptable to change. What those of us have learned in healthcare is that it's neither those with the most money nor those that always get the most healthcare that make the best outcomes when they have illness or injury. So our focus now is on creating more adaptable patients. And in order to do that, we position two very important variables in this equation. And the first of the deck of cards that the good Lord somehow hands out. And that, in the denominator, is vulnerability. It consists of the reasons why you come to us for healthcare, but it also consists of the baggages that you bring, the other illnesses, So imagine receiving a diagnosis of a serious cancer, but also imagine the stressors that you might bring. A young woman, 42 years old, with metastatic breast cancer, divorced, still single, mother of 2 young children, and without any health insurance. So on top of the difficulty of handling this diagnosis and fighting this disease, the stressors that she brings are as much a part of making her vulnerable to healing as anything else. But at the same time, we've learned a lot about resilience. And resilience we conceptualize as consisting of 3 variables: our ability to cope. Not all of us are born with an equal ability to do it, but they can be taught. We have a great and a rich literature on how that can be accomplished. Secondly, social connectedness. A Brigham Young meta-analysis of almost 150 studies covering age, gender, comorbidities, and the severity of illness found that the strength of your social connections predicted a 50% greater survival with those that had strong connections to friends and family. And then finally, the question of access. Unless you have the ability to make connections to health insurance, to a time of day when you can come for care, where you have psychologically and culturally competent healthcare professionals who can look at your illness in a way that makes sense to you and your family, these disadvantage our patients. And so this is the model that we're in the process of implementing, and the model by which we think we can build on George Albie's seminal work from 1982 to begin to look at how we can create and discharge and treat more adaptable patients. What centers all of this is the concept of integrative medicine. We do medicine and surgery very well. What we need to do is to be able to integrate the psychological, the social, and the biological as well. So I mentioned to you just a moment ago that magic number of 99 cents, my book. Even then, no takers. So as we end, let's talk about SCRA 4.0. How many of you in the audience have a smartphone? Very good. What's on that smartphone now are apps, killer apps, those that will get you from here to there. An application called Around Me helped me find the Starbucks in Chicago that was 485 yards away. Gave me directions, the phone number, and it even take me there. So now imagine for a moment there's an app with the SCRA logo on it. Maybe 99 cents. Do we have a product or a service that you would spend 99 cents on? With the general community? What if it was free? What would you find on that application? Would it take you to resources like the Community Toolbox at Kansas University, to our website or our Facebook page, to the Global Journal of Community Psychology Practice? Just what you could do on your laptop. But what if you could connect to virtual communities, instantly welcoming new members or inquiries, working on simultaneous solutions to community issues? Think about what that app could do and what we could create in its place. Let's work together on the challenges that face us in the field. Craig doesn't have a list for us. Past presidents of SCRA have described us as high relevance and high invisibility. And since 1983, we've lost 2/3 of our APA members. SCRA's vision of strong global impact remains challenging. All are opportunities for positive change. And the challenge all of us share as stewards of this field of community science. We're excited about new tools and others to collaborate with. Our Global Journal of Community Psychology Practice can reach 2 billion people with smartphones today with a publication lag in nanoseconds. I've been fortunate enough to know a wonderful group of people in our field, some of whom, as Margaret Mead has said, have changed the world. In fact, she said, it's never happened any other way. But some of those people are at this biennial. Some of those people are in this room who haven't done it yet, but will. I think it's why Emory Cowan signed his letters with Ameliora Emory, and why the Jewish value of Tikkun Olam, perfecting the world, still speaks so strongly to the promise of our field. To Molly and Abe Neigher, my parents, who were never exactly sure what a community psychologist was, but through their examples of how they put the values of our family and our faith into practice, would have made great SCRA members. To them, I am profoundly grateful. And to Susan, Aaron, and Debbie, who constantly reminded me that I am not funny. My unconditional love. This award is greatly appreciated. I thank you, Pat, for those kind words, and to all of you, I will keep practicing until I get this right. Thank you very much.